A heart murmur may have been detected by your pet's vet while listening with a stethoscope. It was quite a surprise when our healthy 6-year-old dog was being checked over after swallowing a chicken bone. Murmurs in pets are caused by abnormal blood flow within the heart, and this usually involves the heart valves themselves. Murmurs can be present at birth, and these are known as congenital heart murmurs. They are also acquired later in life due to diseases or to the normal aging process. It is fairly normal for most pets to acquire heart murmurs during the last quarter, the last third of their lifespan. Some breeds, however, are known for heart problems, and these can occur anytime during their lifespan. There are 6 grades of heart murmur based upon the loudness heard through the stethoscope. And this is probably your first result will be that you will be told that your pet is showing signs anywhere between 1 and 6. A 6 level, of course, is extremely serious. Some of the blood tests that are performed on humans are also done on pets. For the CBC, or complete blood count, will detect problems with major organs like the kidneys and the liver. For these need to be healthy if the heart medications are being prescribed for your pet. There are also blood tests that measure the amount of stretching the heart muscle is undergoing. This is called a pro-BNP blood test. Chest x-rays, or x-rays of your pet's chest, can give important information about the heart and lungs. The heart size, shape, and position can also be visualized, as can blood vessels and lung patterns. An ECG or electrocardiogram can aid in detecting the heart rate and any rhythm abnormalities, such as AFib. It will also look at the heart chamber size and electrical activity within the heart to see if there are medications that might help with this. A cardiac ultrasound of the heart will show the strength of contractions, the size of the chambers of the heart, the thickness of the heart muscle walls, and heart valve function. It will also detect whether there is heartworm or tumors within the heart. The ultrasound is sort of the definitive test of the severity of the murmur. If it's decided that you need an ultrasound, fasting for a number of hours as well as no water will be required, and this has to be determined from the date and time of the ultrasound test. Some pets will require additional sedation for the best results from these. However, you can expect to find out in the same day the shape your pet is in, and also any recommendations that are suggested to help them live a longer and happier life. In some cases, there is nothing that can be done because they are too old, and you probably will likely see not much of a change in pets' behavior. A good heart for you and your pets starts early in life. Everything from genes, diet, and regular exercise will determine the state of our heart as we age. Surprisingly, however, unconnected is dental health and hydration, for these are also factors in how our heart will age, and they deserve equal attention to what we eat and our regular exercise. So before we hit our 50s, or for our pets, an equivalent age range of 7+ years, is the time to be looking out for the future. You can find all kinds of information online about ultrasound results, and even the classification of the 6 grades of heart murmur.